see your driver's license and an insurance card, please?
Yes. My insurance card.
Okay.
My driver's license.
Alright, all is settled. If you take a seat right over there, we'll get you shortly and the doctor will see you soon.
Thank you.
No problem.
Calling Valentine.
Here.
Would you move to the doctor's office?
Come in. Hello.
Hello. Hi there, my name is Dr. Ward. Nice to meet you.
Nice to meet you.
Alright, what seems to bring you in today?
So over the past few months, I've been hearing some tremors in my hand, or
Okay.
my right hand anyway, and my muscles seem to be really rigid. It's really hard to walk sometimes, and when I stand up, I get really dizzy.
Okay.
So
You're dizzy when you stand up? Is it kind of just like a blackout, or is it like tunnel vision kind of thing?
I don't like tunnel vision.
Alright. Now, how old are you?
Just turned 60 about 4 months ago.
Alright. Let's see. I got all your things down. So, how long has you had that shake in your hand?
About 2 months or so.
2 months? Alright. Is it just in that hand?
Yeah.
Alright, now I'm going to ask you to do a couple exercises for me real quick. I
Alright.
want you to try to extend your arm as far as it can go. So just reach out towards me. Alright. Is that the best you can do?
Yeah.
Alright. I'm going to try the other arm, okay? Alright. As far as you can go? Alright. Now, I'm going to ask you to stand up, and if you need any help, just follow me. Got it?
Yeah.
Alright, now we're going to walk. I want you to walk about half past the chair over there, and then come right back. Alright, that's good. Alright. Great job, great job. Alright, now I'm going to ask you, this may be a little odd, but I want you to smell this real quick and tell me what you smell, okay?
Alright. I don't even smell anything.
Sure? You want to try it again?
Sure. Yeah, I don't smell
You
anything.
don't smell anything? Alright. Well, let's see what I have here. Alright, so my kind of prognosis today, based on your shaking, you seem to have a little bit of stiffness and that you can't extend your arms very much, and it seemed like it was a little hard for you to get up. You have a little bit of shuffling in your walk, which is a little bit lack of motor skills. What else? Right. So the thing I asked you to smell, that was actually some pretty strong perfume, okay? So
wow.
you should have had some sort of smell right there. So based on all of those symptoms, I think you might have onset Parkinson's disease. Have you ever heard of it?
Not really, but my grandma seemed to have a similar problem with this. She never really got checked out though.
Okay. Well, basically, in a normal individual, I'll tell you where it all stems from in the brain. So I've got a diagram right here if you want to look at it. So, this is your brain, just kind of like half of it. And your dopaminergic neurons. Now it's a big word, but it's going to be located in this part of the brain called the substantia nigra. And there's two parts on either side of the midbrain, so it's like right around here. So these dopaminergic neurons produce a neurotransmitter called dopamine. Now dopamine is a large, well-known neurotransmitter, and it's responsible for movement throughout the body. So the dopaminergic neurons, they make dopamine, which travels to the dorsal striata, just towards your spine, and from there it's dispersed out to the rest of your body and it helps you move. So in your case, the dopaminergic neurons are dying, and so you're not producing all of that dopamine, which accounts for about 70% of the dopamine in your body. So the majority of your muscle movements, any of your motor skills are decreasing. That's why it's a little hard to walk. You've got some rigid movement. But there's a few causes that we know towards this, but the main cause, usually, we don't know. But some risk factors are being around pesticide, if you're around like some farms, if you've had previous head injuries. Let's see what else. It can also be genetic, which it might seem to be in your case, so a few genes could have mutations. One of them is called the alpha-synuclein gene, okay? And what happens in these dopaminergic neurons, okay, is that there's a buildup of proteins. Let's see if I have one right over here. So, this is called a Lewy body, and it's this buildup right here, buildup of proteins, and that's in the neuron. And so we speculate that's one of the causes of why there's cell death, because it's seen in like people who are also with dementia, so some deterioration in the brain is associated with these Lewy bodies. And it's a buildup of the alpha-synuclein protein. So in that case, the genetics, the gene for alpha-synuclein could be overexpressed in its mutation, and that's why you're producing too much alpha-synuclein protein, and you create these Lewy bodies.
So Lewy bodies aren't normally?
No, they're not normally there. And when we take like an x-ray or like an MRI, stuff like that, we can see it inside the neurons of the brain. Now I have some other things to show you. Going back to the whole dopamine thing, so the substantia nigra, that part of the brain, is down at the bottom. And this is just kind of a comparison of the normal versus the Parkinson's disease. The normal one, you can see these red dots right here is that dopamine coming from the neurons. Now there's a lot of them in the normal one, but this is what yours is doing. You only have a little bit.
Oh, that's not good.
Yes. So there's that, and then I have one more thing to show you. This is just an MRI of one of the brains, and you can see in these parts of the brains, it is deteriorating.
Oh, that looks really bad.
Yeah, so we're going to try to help you out with that, but unfortunately, there is no cure for this Parkinson's disease.
Oh, that's really bad.
There is only just treatment to help your motor functions and just like you feeling well again.
What kind of treatments are they?
So one such treatment is that we have medication. It's called Ladova, and it basically just helps with your motor skills. It just decreases some of the shaking. And we also have an extra form of the drug. If that initial one doesn't work, we have a little bit stronger dose. So there's that option. I've heard sometimes you can help with your diet and go to rehabilitation, some kind of therapy to help with your motor skills. And the last option we have, which is not a recommended option, but it's only for when none of these drugs work, and it's surgery.
Oh.
So what would happen is we put microelectrodes into that part of the brain, substantia nigra, which could help reduce like any motor like functions that have gone bad, so like you're shaking. So those are most of our options.
Will this get any worse?
It will. Your motor skills will decrease, probably your speech will go down, any of your like mental capabilities might be gone. Unfortunately, we are looking about an average of 10 years left. 7 to 14 is typically the range. So if you're looking into any rehabilitation centers or you have any family members to help you out with that.
Cool.
So any of those treatment plans sound good to you?
Well, I'd like to start with the medication.
Okay.
Possible.
Sure thing. I carried around magically some prescription for you. This is about a month, but got that to give you, and let's see. Also have another written prescription for you. Alright, and that'll be good for like another month, okay?
Thank you.
Now I want you to come back monthly for checkups so we can check your progress for the disease.
Sounds
But
good,
I'll
Doc.
give that, put you on your merry way, and hopefully feel brand new.